Hello, my name is Lainey Plattner. I am from Mobile Clinics for You, and I appreciate you taking the time to visit with me today to hear why your hospital should invest in one of our mobile health clinics. The healthcare field is changing rapidly these days due to restructuring of reimbursement processes and changing regulations. Now more than ever, it is crucial to be an innovative healthcare provider to keep up with the tight budgets and competitive markets. And I believe one of the most effective ways to do this is approaching how you deliver your care. That is where I propose your organization, excuse me, jump on board with the Children's Mobile Wellness and Health Education Clinics. This is not only a way to address the changing landscape of healthcare delivery, but it also aims to improve public health and reduce unnecessary emergency room visits that often cost your hospital and payers a great deal of money. Childhood obesity related hospital visits alone estimated cost an estimated $117 billion each year. This mobile unit will aim to set up in communities that are not in close vicinity to your healthcare brick and mortar locations and can also be requested by schools across the valley for health education purposes. By delivering wellness visits and providing health and nutrition education to children and families who can normally not afford to access these kinds of services, the mobile health clinic will create a huge return on investment, provide you with a fantastic PR benefits, and make you a competitive entity in this volatile market. The traditional delivery of healthcare via a permanent brick and mortar structure can be restrictive and timely to reach the break-even quantity. This delivery model wants to break your organization free of these restrictions. Compared to the average static delivery location, the majority of the cost is an upfront one, estimated around $500,000 in the first year. This price actually includes the vehicle and equipment, interior and exterior design, and necessary permits and licenses, which is actually a pretty great deal. While this upfront $500,000 may seem like a large amount of money for us to ask you to invest with us, but many providers are able to fund these upfront costs through many different avenues. For example, corporate sponsorships, various grants, private foundations, and government funding, depending on the population that your hospital will be serving with these clinics, are all feasible options to look at because these clinics are seen as community service programs and opportunities. Each year costs an estimated $250,000 after this initial $500,000, and these costs are comprised mostly of staffing costs, which can be avoided by creating beneficial pro bono relationships with local providers. We here actually have a large pool of providers who are willing to work with any organizations that use our mobile clinics, and we have contracts with various suppliers who provide discounts to those providing these services. Although it will be necessary to put together an incremental budget for this new project, many of the costs can be offset by creating beneficial relationships and applying for various forms of funding as discussed before, and this is something that we can talk about more as well. Because the mobile clinic vastly increases your organization's ability to serve generally unreachable populations and geographic areas, your projected value of production units grows, making the mobile unit a revenue center for your organization and not a cost center. A mobile unit will allow your hospital to increase its volume of billable visits with physicians and will also help your frequency of costly emergency room visits, will help reduce your frequency of costly emergency room visits due to chronic ailments and a lack of general practitioner availability. Overall, it's a great example of an aggressive revenue management strategy because it creates a new market without affecting your organization's current members, and the mobility increases your market by reaching those not normally serviced by your organization. If you need more convincing, just take a hint from the food truck industry. Similar to the healthcare field, the restaurant industry has generally been a brick and mortar delivery model, but in recent years, food trucks and kiosks have really taken off. An industry research firm's analysis shows that food trucks are now a $1 billion industry, and that has grown 8.4% in the last 5 years, and has, compared to traditional restaurants, a very low overhead. There is no reason why healthcare cannot follow the same route, no pun intended. Along with the recognition for innovation and forward thinking, as well as the return on investment, a mobile clinic has the capability for self-promotion and is a great vehicle, no pun intended again, to develop beneficial relationships with local schools, physicians, and nonprofits around the valley. Everyone wishes they had thought of opening a food truck. Don't be that organization that says, I wish I had thought of that, when 5 years from now mobile clinics are a staple for major providers across the country. Thank you.